So the parietal that is dominant, it is a function of language and calculation. So whenever there is a problem with the dominant parietal lobe, there will be a language problem and calculation problem. Language problems such as dysphagia, acalculia, inability to calculate, dyslexia, inability to read, apraxia, inability to perform complex movements. For example, inability to dress herself or himself, and agnosia, inability to recognize faces or objects or people. So if there is a lesion of the parietal lobe or dominant parietal lobe, what will happen? What behavioral problems can occur in a lesion of parietal lobe? The behavioral problems in a lesion of parietal lobe is dysphagia, acalculia, dyslexia, apraxia, and agnosia. Inability to read, inability to calculate, inability to perform complex movements, and inability to recognize people, objects, or things. What will be the physical signs? So you all know that the sensory areas or the body sensation are controlled by the frontal lobe, parietal lobe. Frontal lobe control the body movements and parietal lobe control the sensation of the body. So the physical signs that is associated with the parietal lobe will include contralateral hemisensory loss, and the other one is, what can anyone of you tell me what visual problem can arise from a lesion of parietal lobe? In yesterday's lecture, I told you about a mnemonic to remember that to remember the findings.
It's parietal
Yes. So
inferior
what will be the visual problem in parietal lobe lesion?
be inferior quadranopia,
Yes,
contralateral.
inferior quadrant anopia. So physical signs of parietal lobe damage include contralateral hemisensory loss and contralateral inferior quadrant anopia or lower quadrant anopia. Along with that, the behavioral problems which can points you toward parietal lobe lesion includes dysphagia, acalculia, dyslexia, apraxia, and agnosia. Also, there will be astereognosis and agraphesthesia. If you ask the patient to close his eyes and ask him to identify any object just by touch, then he